Understanding how to detect breast cancer at an early stage is of the utmost importance for every woman. About 14% of women are diagnosed with breast cancer, making it one of the most prevalent forms of cancer in females. Although it is something that may occur to women of any age, the likelihood of it happening to them increases as they become older. Regrettably, a significant number of women do not survive breast cancer because they are unaware of how important it is to detect the disease at an early stage. By the time that many women seek medical attention for their condition, the cancer has already progressed to a more advanced stage, making it more difficult to treat and decreasing the likelihood of survival. On the other hand, the good news is that breast cancer can be treated, particularly if it is detected at an early stage. As a result, it is of utmost significance for women to be aware of the initial symptoms of breast cancer. This is just a friendly reminder that we are not medical professionals. Number 1. A bump that you feel close to your collarbone. When you find a lump close to your collarbone or underarm region, it might be a cause for concern since it may be an indication that breast cancer has migrated to lymph nodes in the surrounding area. It is possible that these lumps will feel solid, immovable, and occasionally painful when touched. The process by which breast cancer cells move outside the breast is referred to as metastasis, and it can make therapy more difficult. In spite of the fact that not all lumps in these regions are malignant, it is essential to have them examined by a medical professional in order to ascertain the reason for the lumps and the most suitable course of action. Number 2. Sensing a bump beneath your arm or in your breast. When you feel a lump or bulge in your breast or underarm, it is imperative that you take it seriously and get medical attention. This lump may have a distinct sensation compared to the tissue that is surrounding it. It is possible for them to be rigid, of an uneven form, and frequently painless. Discovering a lump might be nerve-wracking, but it is essential that you do not ignore it. This might be an indication of breast cancer, which is characterized by the growth of abnormal cells in the breast tissue. Having said that, not every breast bump is a malignant growth. There is a possibility that some, like cysts, are harmless. It is crucial, however, to get any new or developing lump examined by a healthcare expert in order to rule out the possibility of cancer and ensure that appropriate treatment is administered, if it is required. Number 3. Having nipple or breast pain. Pain that is chronic and cannot be explained in the breast or nipple should be brought to the attention of medical professionals, even though many breast cancers are painless. This pain may present itself as a dull ache, a sudden stabbing feeling, or a burning discomfort, and it may be restricted to a single place, or it may be more widespread. Pain in the breasts may be the consequence of benign illnesses such as hormonal changes or fibrocystic alterations. However, it may also be an indication of breast cancer. In light of this, it is imperative that any breast or nipple discomfort that persists or worsens be brought to the attention of a healthcare practitioner in order to receive an appropriate examination and treatment. Number 4. Your breasts are swollen all around. Insular breast cancer, also known as IBC, is a kind of breast cancer that is extremely uncommon and aggressive, and it has the potential to cause the entire breast to expand. This swelling can cause one breast to look bigger than the other, and it may also be accompanied by redness, warmth, itching, or a sense of heaviness in the breast. In contrast to other forms of breast cancer, intraductal carcinoma, IBC, may not manifest itself as a characteristic lump, but rather as a widespread thickening of the breast tissue. If you suddenly suffer breast swelling, it is imperative that you get medical assistance as soon as possible because of the aggressive nature of the condition. Early discovery and treatment can have a substantial influence on the outcomes. Number 5. Your breast size or shape abruptly changes. Alterations in the size or form of one or both breasts that occur all of a sudden should be considered concerning and should not be disregarded. It is typical for breasts to experience a modest shift in size as a result of hormonal fluctuations. However, if the change is obvious and continues for an extended period of time without any apparent explanation, it may be an indication of an underlying problem, such as breast cancer. It is possible that this shift will take place quickly, and it may be accompanied by additional symptoms such as changes in the skin or discharge from the nipple. If there is a major change in the size or form of the breasts, it is necessary to consult a medical specialist in order to ascertain the reason of the change and the proper actions to take next. Keep in mind that the most important factor in properly managing breast cancer is early identification. It is imperative that you seek the guidance of a qualified medical practitioner in the event that you see any of these symptoms or if you are concerned about the health of your breasts. It is imperative that you consult a medical professional if you observe any of these symptoms. It is important to be aware of the symptoms of breast cancer and to get treatment as soon as possible. Breast cancer may be a frightening disease. It is important to keep in mind that we are not medical professionals, and the material presented here should not be given the status of medical advice. Simply said, the objective of this video is to provide information. When seeking medical advice and treatment, it is always better to consult with your primary care physician. They are going to have a better understanding of your specific problem.